Well, thank you very much for the introduction. It's my pleasure to be here, and just want to thank everyone who's been on the planning committee for LESS. I didn't know about this opportunity last year, and so far this year I've been really enjoying all the sessions. It's very relevant. I think a lot of us are really involved in these evidence syntheses, so it's great to learn from one another. Um, so the title here, Building Capacity for Library Systematic Review Support Internationally. I'm going to talk about an open educational resource that other libraries can distribute, adapt, and build upon. But I am going to start right at the very beginning of how this came about. If I can just click to the next slide, that is. Okay. So I work at Queen's University in Kingston, Ontario, and at Queen's, our health sciences library is called Bracken. We have 7 health sciences librarians that serve approximately 1,500 faculty and approximately 5,000 health science students. We have the MD program, so our medical students. We have the postgraduate medical program, so our medical residents. We have undergraduate students in the life sciences. We have a Bachelor of Health Sciences program, nursing students at the undergrad and grad level. We have graduate students in public health sciences, and we have graduate students in the rehabilitation therapy program for OT and PT. If you remember seeing this a few years ago, there was this article that showed how nearly 80 systematic reviews were being published each day, and that estimate came from the number of systematic reviews being indexed in Medline per year. So, this is from 2019, but it's a perfect starting point because this is when it started for us conceptualizing this educational resource. If we were to sort of put a similar graphic about library consultations at Bracken Health Sciences over the years that we were doing for knowledge syntheses, I feel like it would follow the trend here where we, year after year, just kept seeing a steady increase in the number of students wanting to meet with us, but also researchers wanting to collaborate with us, have them on the review team. So in 2019, we were trying to figure out how to keep up. The demand for systematic review support, both in a sort of educational capacity, but also in a collaboration capacity, continued to increase year after year. We were looking for more efficient strategies for delivering support to address time constraints for our relatively small team, capacity issues for trying to provide that support. And so the thought was that offering regular library workshops to cover the basics of systematic review searching could be more efficient than having librarians meet with individuals groups. I say could be because as anyone who's planned a workshop series knows, there's a lot of work that goes into that as well. So I looked at other workshops that were published in the literature, and I came across the librarians at the University of Alberta. They described a monthly 3-hour introduction to systematic review searching in-person workshop that they did. It was accredited for continuing education by the Royal College of Physicians and Surgeons in Canada. And in that publication, they talked about how workshop participants were often indicating that they would like additional workshops on other parts of the systematic review process, such as data extraction and statistical analysis. And just from our experience with working with students and researchers at Queen's, we found that a lot of times they would try asking us librarians about other parts of the synthesis process that they just weren't familiar with, but that we didn't have the expertise to sort of talk them through. So let's get to the next slide here. So the pre-COVID plan, remember this was 2019, and now we're moving into the very beginning of 2020. The plan was to develop an in-person workshop at Queen's that would introduce learners and reviewers to all stages of the systematic review process. So in doing that, I had to work very hard to recruit people with an epidemiology background and background in systematic reviews that felt comfortable teaching that content. It was very interesting because when I reached out to epidemiology faculty initially who taught about systematic reviews, they said, well, I actually don't have a lot of practical experience doing systematic reviews. And then when I would reach out to faculty doing systematic reviews, if they wanted to collaborate, they would say, well, actually, I've done them, but I don't know if I've even done them well. I don't have a strong background in methodology. But fortunately, I was able to find two students. So one was a medical resident who was taking time off to do an epidemiology master's, and another was a friend of theirs who was doing their PhD in epidemiology at Queen's, and they agreed to be part of this team that would help author and produce the content for the workshop. And so that's sort of where it started. And we were hoping that this would help address common challenges that were faced by librarians and reviewers, including time constraints, capacity issues, but also reviewers' lack of awareness of the review process and best practices. So even, researchers that had done reviews before, we would find a lot of times that they didn't have a great understanding of what best practices were and how the review process actually should look. So it wasn't just about wanting to educate students, but also faculty and researchers. And we wanted to address gaps in support that were available for reviewers here at Queen's who, beyond getting help with maybe the review question and searching, which librarians often provide help for, getting help with those other areas that we get asked about. So then what about risk of bias? What about data extraction? And sure, we can say, okay, we know some tools for risk of bias assessment and whatnot, but we couldn't go much further than that. So ideally, having a workshop that covers all stages of the systematic review, ideally this would lead to the production of higher quality systematic reviews that were being produced through Queen's and result in better healthcare and policy decisions, sorry. The primary target audience would be students and faculty and researchers, staff in the health sciences. And we would apply for continuing professional development accreditation from the Royal College of Physicians and Surgeons Canada and from the College of Family Medicine Canada. But then in 2020, right after I met with this team and we were talking about our in-person workshop, literally the next day was when everything shut down in March. So we shifted to working remotely, and of course, our learners shifted to learning remotely. So this was my setup at home, working remotely, and my cat Cleo was the big winner of that pandemic for sure, like many pets out there. So now that we had this time to sort of reflect on, well, where does this leave an in-person workshop? We thought maybe we should do a needs assessment to see if we switch to building something online, would other libraries potentially use that and find that useful? So initially, we were really focused on this whole, we'd make it freely available. So we're going to switch from in-person workshop to a module series. And what we did is our team did a survey in 2020 of basically libraries that were similar to ours. So libraries that were supporting Ontario medical schools. That included both academic libraries and hospital-affiliated libraries. So we had 13 libraries respond to this survey, and they all reported that they would be somewhat to extremely likely to incorporate or recommend freely available online education modules for systematic reviews. If you'll recall, Cochrane Interactive Learning is available as a module series, but that comes at a cost. And so particularly at this time, there just weren't a lot of other free options for having a full online module series or something similar for all stages of the systematic review process. So our initial idea was just really centered around building something that people could use. They could distribute and share with their library users as well. Later, the vision expanded to having other libraries adapt, remix, build upon when we started to think of it more as an open educational resource. So I'll talk more about that a little later. So, when assessing aspects of systematic reviews that libraries perceived as requiring most support by library users, the majority of libraries identified developing a research question, search strategy, and screening as areas of needed support by the library for researchers at their institutions. When these libraries were asked about perceived gaps in support provided at the institution, libraries were more often identifying those other systematic review areas like data extraction, analysis, and presentation of results as being areas of needed support. So the divergence of the perceived needs of library users and perceived gaps in researcher support at the library institution level really demonstrated this need for systematic review support that goes beyond the expertise that librarians generally offer. So the new plan. So in 2021, our new plan was to develop a freely available online module series that would introduce learners and reviewers to all stages of the systematic review process. Queen's has an institutional subscription to Articulate Rise, so we use that as an author tool. And we decided to use a sample review question throughout to demonstrate, for example, searching, data extraction. So we used a quantitative systematic review question, and it followed the PICOS research question framework. So the series is called The Essentials of Conducting Systematic Reviews, and you can see the 8 modules, how we broke them down here. Module 1 also covers how systematic reviews are different from other types of syntheses and even from traditional literature reviews. And some of these modules, for example, searching for eligible studies, selecting studies, these could be just as relevant to learners conducting other types of knowledge syntheses. So even though it's part of this broader systematic reviews module series, the individual modules, some of them disseminating findings, using review tools, those are also just as relevant for other types of syntheses. So the first module was ready a year later in August 2022. I did that one. And then the Dr. Jennifer Ratanja, who was finishing her PhD in epidemiology here at Queen's, she finished module 2 in August 2023. And at this rate, this module series was going to be years and years to come. So we thought, okay, how can we get more support for building this module series? So our interprofessional team initially started with having the support of Dr. Solius, who is the director of continued lifelong learning here at Queen's in the health sciences, and then Dr. Jennifer Ratanja and Dr. Murr, who was the medical resident who was also doing the master's in epidemiology at the time. And so what we were able to do in 2024 was hire content writers. We found that there was an open educational resource grant available through Queen's University Library. We hadn't really thought about, while we were making a module series, we hadn't thought about it as being an open educational resource, but framing it that way helped us realize, oh, okay, we could apply for this grant and then we could have money to pay some writers. So we were able to recruit 2 PhD candidates from the epidemiology program who were able to basically just focus on helping us write some of the content. Later collaborator Emmanuel. Reynard comes along a little later to help with translation, which I'll mention later on. So now we have these two graduate students who can help us write some of the content. So this is sort of the process of the different modules and when they were available. So actually, Module 7 was just introduced a couple months ago, and that was the last module to be completed over the course of what seemed like an eternity from 2022 until now. And then, of course, since so much time had passed, some of the modules have already undergone a review and update. And even Module 8, oh, it's been renamed. It's now Review Tools, using review tools and automation and AI. So that was updated just a month ago because obviously things are changing very fastly in the world of AI. So wanting to keep that module current. But you can see how it took us years to get this whole series finally completed, but we are here now. So this module series is findable on the Systematic Reviews and Other Syntheses library guide through Queen's University. You can just Google Queen's Library Syntheses and the guide should come up. If you go to the page for training modules, that's where you will see a link to all of those modules. These are permanent links. Initially, when we were updating the modules, some of them got a new URL, which caused some confusion and also made it difficult for libraries that were directing people to those modules. So now every time an update is made, the links stay and the content just will be updated from there. The module series is also linked from our open education resources at Queen's page, which just links back to the content on that guide. So we built the series in Articulate Rise. Some of you may be familiar with what that looks like, but from the learner's perspective, this is what they would come in and see when they start a module. On the left, they have their table of contents. So for each module, we have about 3 to 5 different lessons. And the each lesson, sorry, has at least one knowledge check. So these aren't required to continue going through the lessons or the module, but they're there just to make sure that the information is being understood and retained. And then at the start of every module, there are 3 to 5 learning objectives that are listed. At the end of the module, there is an evaluation and certificate link that can be completed. The feedback survey was only introduced beginning in June 2025. So we wanted to get an idea of who was using the modules, whether they were from Queen's or they were external, whether they were student or faculty and staff. We wanted to know, did the modules meet their stated learning objectives? What are 3 key takeaways from the module? And will you incorporate what you learned into your practice? After doing the anonymous survey, they can generate a certificate of completion. So this will be emailed to them. This is what it looks like. So it'll say the title of the module, for example, the date it was completed. And the modules are all accredited for CPD. So if when you get that email with that certificate, that is what can be used by the different colleges here. So over the years of developing the modules, because the first module was available in 2022, there's been promotion to other libraries. So a few different ways this has been done, local and national conferences, and then through listserv emails. You may have seen some go out today. So Can MedLib, Knowledge Synthesis Interest Group through CHLA, Expert Searching through MLA. So initially, when we were thinking about developing the module series and just making it freely available, all of our promotion centered around encouraging libraries to distribute, to share the module content. And we were very pleased to see that there were a number of libraries at other universities that were linking to the modules from their own websites and guides, including institutions in Canada like U of T, McGill, Dalhousie, and Trent, and also in the US and in the UK and Switzerland and other places, which was cool to see. We have Google Analytics. They've been embedded to every module from the beginning. So we've been able to track this over the lifespan of every module and every module update. So we know that learners are coming from 87 countries on 6 continents. And we know where our learners are coming from in terms of the most represented cities. So we have over 750 cities that learners are coming from. The top 5 are from Ontario. So we have Toronto, Kingston, Montreal, London, and Ottawa represented there. We've had a total across the 8 modules of over 3,400 unique users and total page views over 7,200. Google Analytics, I'm not a pro, so it's kind of hard for me to decipher some of that page views. Is that sort of accessing the module? If you recall, most modules have 3 to 5 lessons. So technically accessing one module might be 3 page views. So it doesn't appear that every user going in is maybe viewing the whole module. Trying to deduce what I can from the analytics in Google. So we have some feedback that's been available since June of last year. I'm just providing a summary of what I already had to collect in April of this year. So it's about 10 months of data. We've had 203 learners complete the survey, and so we can see where people are coming from. So externally, we can see that a number of students and faculty are actually the majority of the users for some of the modules. Module 7 isn't listed here because this is from April, and we just introduced Module 7 on disseminating synthesizing findings a couple months ago. Percentages are shown here because not all respondents answered this question, so we just simplified there. It's really hard to click forward, so I apologize for the pause every time I'm moving forward. Okay, so when asked if the module enhanced their knowledge, respondents for each module most often strongly agreed, with over 94% of respondents somewhat or strongly agreeing for each module. But you just can't please everyone all the time. And then when asked about the likelihood of incorporating concepts from the module into their practice or training, respondents most often were saying that they were somewhat to extremely likely to incorporate the concepts. So we've received some testimonials and comments from learners at Queen's and outside of Queen's. This is a testimonial from a student outside of the health sciences at Queen's, which was pretty cool. So this is from a PhD candidate who's also doing their MD. So Queen's Department of Chemical Engineering, saying that they found the module series to be useful. So I think that that is good for us to realize that at Queen's and other institutions, it's not just people in the health sciences conducting systematic reviews. We have people in education, psychology, kinesiology, engineering, doing these reviews as well. So being able to see that just going over, some of those main steps can be helpful, even if they're coming at it, from a different discipline. This message from a librarian in Zurich, which was nice to see. Sorry, it's so hard to go forward. with the next, yeah. And so then from our friends in the US and from our friends at home here in Ontario. So great to see that other libraries are already using the modules, promoting them. But now, just recently, starting to think more about promoting the module series as an open educational resource, not just as a free resource that they can distribute and share. So I think the main thing here is to try to help libraries from having to reinvent the wheel. So instead of starting from scratch, libraries can revise and build upon this content to save time and focus their efforts on customizing the content and format for their own purposes. So the modules are licensed under a Creative Commons Attribution, non-commercial, international license. So this allows users to distribute, so share, post, remix, combine with other material, adapt, modify or alter the material, build upon the material, extend, create from it in any medium of format. So whether you're putting together your own PowerPoint slides for instruction, or if you have your own LibGuides or website pages, and for non-commercial purposes. And the license just requires that reusers give credit to the creator. Facilitating reuse. So really starting to think more about the module series as an open education resource. Fortunately, reuse was already in mind when we were thinking about it being shared by other libraries. So it was written with reuse in mind. So only the feedback survey and certificate use the Queen's branding, but other than that, you don't see it throughout the modules. We don't, say, okay, we use this database on this platform at Queen, so that's the only one we're going to show you when we're introducing bibliographic databases. We introduce all the different platforms. When we talk about review tools in Module 8, those are not specific to Queens. We also used universal design principles applied to support diverse learners and technologies. So using alt text for images and figures, using sufficient color contrast and descriptive hyperlinks. And then facilitating reuse, making sure that we have clear attribution information and suggested citation text, just so that not everyone's having to try to think, oh, how do I cite these? So these are available from the library guide where the links to the modules are, so you can cite the module series. And then there's also how to cite individual modules. I'm also in the process of making all of the content that's in Articulate Rise available as editable source files. So as Word documents, easier for other libraries to sort of just copy the text that they want to bring over to their own slides, to their own guide. And then we'll also be making any graphics or figures that we created in PowerPoint or using other tools. We'll make them available separately so they can be edited more easily. And then we're going to investigate hosting the modules in a stable repository where they can be easily discovered. So I'm looking at eCampus Ontario. I've already submitted an application and waiting to hear back about that. But otherwise, if you know about them, you know where to find them on the Queen's Library Guide. So just a few discussion points. For librarians, instructors interested in assigning any of these modules as a prerequisite to a consultation or as a required learning for a course, finding ways to encourage compliance is key. One of the main issues, I guess, that we experienced here at Bracken is if we would refer people to the modules before having a consultation. So for example, take a look at the module on searching for eligible studies, and the students would show up and they wouldn't know what grade literature was. And you're like, oh, did you look at that module? And oh yeah, I might have briefly scanned it. So I mean, whether they accessed it or not before, now we have, you can have them forward that email certificate of completion to at least ensure they went into the module. But I mean, how much they engage with the module is it's hard to force that. Content from this module series is currently being used to was used is used in a workshop that was developed at Bracken for people who want to have some hands-on training or do more of a workshop-based learning experience. We really encourage students to review modules before attending the workshops or having a consultation with the librarian, so we're not introducing the basics over and over again. Next steps, if I still have 30 seconds from when I started my timer, is to continue working on the French translation of the module series. So we were fortunate to have a collaboration opportunity with Emmanuel Reynard from Laval University, who is in the process of translating the content for us. Module 1 is available so far. Module 2 will be available in the coming weeks. Continue reviewing the feedback that we're receiving from the evaluation surveys so that we can incorporate that as we update, and continue to make sure we update and review the modules at least every year to 2 years. And then we're hoping to do some future research assessing the effectiveness or the efficiency of the modules and if other libraries are using them. So couple final thoughts. We're hoping that these modules can provide an effective and efficient ways for other libraries to support their systematic review services, but they're not meant to and cannot replace the value that direct support from librarians and other methodologist experts can provide. So we use these modules as sort of like, this can introduce you to the basics, but then we still have consultations with teams to go over their very specific questions and review topics, searching and that sort of thing. Thank you.